So as long as it works, so that's a good opportunity for people who may not be able to write a $10,000 or $12,000 check for a program to get through it for free. It's a good investment.
Any other commissioners? Brett, I just have one question, or maybe you could explain. I know one of the bigger issues in this county, and you guys doing a wonderful job. It's sort of a question you have a chance to answer it. Is could you explain the process when a patient is encountered their choice of emergency rooms and taking how you best address that service?
Sure. Every patient that we transport, one of the questions we ask them as soon as we get to the point where we're going to initiate transport is what hospital are they going to go to? What ER are they going to go to? Most people do have a preference based on their affiliation to their physician and where they have always gone. And that's very important that we honor that request. Some people will say they don't have a preference. In that case, we'll take them to whichever is closest. There are a few things that are driven by protocol where we do have to go to a certain facility. Trauma is a good example. If a trauma patient meets certain criteria, they have certain injuries or a certain combination of injuries, they have to go to a designated trauma facility. And in Michigan, there's 4 levels. Midland is a level 2. Locally, we have a level 4. So, and it's a 45-minute window. So if we have an accident in the city of Mount Pleasant, we're within 45 minutes of Midland, which is level 2. Patient meets the certain criteria that will transport them. So some of that's driven by protocol. Heart attacks are another thing. We can assess the type of heart attack someone's having, and if they meet certain criteria, we can activate the cath lab and with them. And the cardiologist and his entire team, when we get there, will be in the lab waiting for us. That's, for me, that's one of the biggest clinical things we've seen here in the past decade, because those people won't have overwhelmingly good outcomes where prior they had overwhelmingly bad outcomes. And that makes that's a really great thing to be able to do here, is give people to the field care.
Thank you. Thank you very much for your presentation. Thank you for your hours. Next up, we have the Isabella County Restoration House ICO agent. Thank you, Dr. Over.
Thank you. I saw that to yell. Thank you for letting me come and report to you on the services of the ICRH. We have been in existence since 2013. A group of interested individuals wanted to start a shelter of some sort for homeless individuals. And oftentimes, homeless people, you don't readily see them. They're hidden from view. And so it's hard to know at first glance how many people we have in Isabella County that are homeless. And it's hard to count them. The HUD requires every state and county to do a pit count that is an indication of the best guesstimate of what we have for the number of homeless in our county. And every county does them at the same time, and they try to choose the coldest week out of the year to do them. And you traditionally, we incorporate a lot of individuals to do this count so that we can make sure we're hitting every pocket, every nook, every cranny, under every bridge, wherever homeless people might be hiding from us. Due to COVID, that did not happen. We did a pit count, but it was only people who were hoteled or in shelters. And so the pit count for 2021, it looks a little bit different than previous pit counts because there wasn't the aggressive searching for homeless people at that time. But the statistics will show you that generally in Isabella County, we have about 500 people that are homeless. And it is hard to serve all of them at one time. And they have various needs. Some of them have dependency needs. Some of them have mental health needs. Some of them have health needs. And so it's hard to accommodate all of that at one time. And I'll be flat out honest with you, not all of them want to come to the shelter. We have rules they have to follow, and some of them don't like those rules, so we're going to be the last place that they call. And that's okay, because I'm limited in the resources that we can provide, but we try to provide the best resources that we can. You will see that the best statistics that we can find, again, they're not always accurate, but the graph that you see states that there's 135 Mount Pleasant High School children without a fixed address. So they are homeless. And that's a lot of children who are not sleeping properly, getting proper meals, hygiene taken care of, and that affects their schooling. We do work with Mount Pleasant schools, Shepherd schools, to try to accommodate these children. And, you know, when I have a child come into the shelter with their family, first thing I do is call the McKinney-Vento representative for Mount Pleasant schools and say, hey, I've got a child here, and we set up a time for them to work with that family. So we try to connect them to everything that they may need. I can tell you that when someone is staying at the shelter, all of their basic needs are met. They have a bed, they have bedding, they have a pillow, they have a blanket, they get their meals, and due to a donor, a very generous donor, they now have a shower and they can do laundry. And we have snacks. And so their basic needs are being met. We work very closely with the Isabella County Soup Kitchen. And this last year, they provided meals for us on a daily basis. And so we would order meals because at the day shelter, we don't have the accommodation to prepare meals. And so they would bring the meals in to us and we would distribute them. And, you know, so there's various community partners, about 36 that I can keep track of, that work with us on a regular basis. And even this year throughout the summer. Some interested individuals decided we needed to address this problem in Isabella County, and they looked at different models across the state and decided to go with a seasonal rotational model. What that means is we are open for housing people from late October through mid-April. And that is our season. So that's the coldest time of the year that we house people. Then rotational means that we cooperate with local churches and they house our guests for a week. And then we rotate to various churches. And anytime you want to see all the equipment that goes with us, you can stop by and I'll show you the 2 storerooms of equipment that travels with us. That's their bedding, their mats, the supplies, everything that goes back and forth amongst the churches with us. And Commissioner Hope has helped us set that up many times, and so he's very familiar with that. In 2017, we were housed at the Strickler Center for a short period, and they gave us an opportunity to welcome people during the day. In the afternoons, they could come and they could stay, but the Strickler Center didn't quite have enough room for all of our guests that we would have. And so in 2019, we rented what was the Summit House or Summit for Community Mental Health Services in Centennial Hall, and we refurbished that, or it's not Centennial Hall, it's West Michigan Building or something like that. Most people know it by Centennial Hall, and that has become our day shelter. And so we utilized that over the last couple of years to accommodate people during the day. And that gave them a place to come to get out of the weather. It was open, it began being open at 1 o'clock and they could come and go. And then in the evening, we would ask them to stay and sign in, and then they would be transported to the whichever church we were being housed at. Last year during COVID, I don't want to relive it. I don't mind saying it was very interesting. Knowing that, one, there was a chance for the shelter in place order, And we didn't want to put everybody in hotels for an extended period of time. That was a decision we had to look at, and you decide, what are we going to do? Also knowing that our volunteers would drop drastically, partly because a lot of our volunteers were now in the high-risk category for COVID. And so those were two of the huge situations our board had to face. And we made the decision that, okay, let's fundraise, let's write grants, whatever we can, we're going to be open 24/7. The soup kitchen was not open, and traditionally we would take our guests to the soup kitchen in the morning. They would have breakfast, some of them would stay through lunch, and then they would come to the day shelter. Well, the soup kitchen wasn't open. And Maury Courts wasn't doing showers. And the library wasn't open. So where do homeless people go? It's 20 degrees outside, it's snowing, it's sloppy, where do they go? So our board made a decision to be open 24/7 and to staff 24/7. So our staff went from 5 to 13, and that's stretching our staff, their capabilities quite a bit. But we made the decision, and we also worked with the Mount Pleasant, City of Mount Pleasant, to obtain permission that if there was a shelter in place for them, or if churches shut down on us because they couldn't open, we could stay at the day shelter. And so for 9 of the 27 weeks that we were open last year, we were housed at the day shelter. There was an emergency order, and we couldn't go to any of the churches. And so we worked with our staff and our board and identified the number of people we could accommodate following social distancing and the usual guidelines. We have our plastic barriers are still up, and anticipating opening again this fall. But we averaged 26 people a night at the day shelter and in the churches. And when we were at the day shelter, we tried to keep it down to 20 as much as possible, just to accommodate with vinyl plastic hanging so that we could pull curtains, and here's the women's section, here's the men's section, here's the family section. So we tried to accommodate that and safety as much as possible. But throughout the season, we did average 26 individuals. That is the same average we had the year before. And so we were able to serve a number of people throughout the year and have them there all day long. They got a little stir crazy in the spring as it got warm, and I wasn't letting them just wander the streets. And went, no, we have guidelines. We are following the HUD guidelines for emergency shelters, pandemic guidelines. We have incorporated those, we reviewed those, making sure that we're following all the guidelines that we need to keep people safe. And I can gladly report we had no COVID cases at the shelter last year. So we were doing something right during all of that time. One of the big changes for us this year is that we decided to open, we were able to obtain as a subcontractor through ACAP, some emergency services funding that allowed us to open for the summer on a part-time basis. So the day shelter, we are not housing people. We don't have enough churches to do that year round. Everybody asks me, why aren't you open year round? We don't have enough churches to do that year round. But the day shelter is open 3 days a week from 11 till 3 so that homeless individuals have a place to get a meal, to shower, do laundry, use our Wi-Fi, sleep on the couches if they want. And so, so far, we opened June 1st, and so far we have had 55 individuals, including families, register and be referred for the program. We are asking that everybody is referred by a professional so we can validate that they're homeless. I know there's a lot of people that could use the laundry services, but our purpose is to serve homeless. And so we want to validate that they are homeless, and we ask that they are referred. A church can refer, a counselor, anybody can, a professional that can validate this individual is homeless. And so we've been working on helping them with that, referring them to other services. So thank you.
Thank you. Anybody have any questions?
Just one D came out last year in January and guided us through a very difficult year. Done a fantastic job. The question I get from folks when I talk about ICRH is why is it seasonal? Why? You know,
Seasonal
obviously,
mostly because we're rotational and we do not have enough partners who can access throughout the year. That's the only reason.
Thank you very much.
Thank you.
Next, we'll have consider approving the fiscal year 2022 budget for the Detroit County Commission on Aging at 0.88 of money that
there. So as far as our budget for FY '22, it is estimated at $2,664,507. With that, we do have 15 different revenue streams supporting 13 different programs throughout our programs at the Commission on Aging, employing 36 different individuals, 18 full-time, 18 part-time, across 9 different pay grade levels. When looking across our revenue projections for FY '22, you'll see that our millage is by far the most significant of any of the funds that we do have. So we have over the years that we've levied the 0.88 mils, and I'm requesting to do the same amount for fiscal year '22. When we did our fiscal year '22 budget, we realized the numbers that we actually received in fiscal year '21, and with that, we would provide and cover all of the programs and services of the Commission on Aging. So with that, I'm requesting that we maintain the same amount for fiscal year '22.
No, I just want to say is that Commission on Aging has no choosing up front. The services that we provide in this facility to the adult population is astounding. And something you and your staff and the board of commissioners should be very proud.
Commissioner Jones, Commissioner H, you guys are great job. I know that you've had to curtail 2020 some of your programs, so kind of meals, maybe some of your home work, some other services. And I know you get grant funding. Is there any negative ramification if you don't have the programs, able to move monies around or you have to return them?
No, we don't have to return anything. We've been really fortunate through the funding we received through the Region 7 Area Agency on Aging for our programs that we weren't able to provide because we weren't allowed to provide them. Like our congregate meals program, they did provide us the opportunity to request to have a cost reimbursement funding as opposed to unit-based reimbursement, because even though we still were providing the services, we still were paying for our facilities, we were still paying for staff. So we still were incurring the costs that we would with those programs. So we were able to switch to the cost base and still be able to bring that funding in. So that was wonderful. We were able to do that with our foster grandparent senior companion program. They have been wonderful in allowing us to continue to pay the stipends to all of our volunteers, both foster grandparents and senior companions, even though they've not been able to serve. We've been able to be creative with different trainings and different ways we could get them involved. We were able to purchase tablets and laptops so that our foster grandparents could interact with their classrooms and still get some of their service hours in. So we've been able to be really creative, and they've been incredibly supportive throughout the pandemic.
I echo what Commissioner Jones said. Instead of one facility here puts us off as commissioners, serves the community very well. For those having mother groups, and also just with our county. This. So thank you for all your
Thank you.
staff. Right. Next, consider approving the fiscal year 2022 budget millage. Isabella County Medical Care Facility at 1.0. Isabella County Medical Care Facility is 1.0. I believe last year was the first year they went to 1.0. Before that, I think they were not 100% certain. Commissioner Godu?
I just had some questions and I don't know if we could maybe attend a work session.
She didn't have it on the line. I'm sorry. Oh, there.
Oh, yeah, okay.
That's great.
Didn't look up, sorry.
I don't have the best audio to hear you for some reason. Can you hear me?
Yeah.
We can.
So can you hear me?
Yes.
Okay, I'm gonna move my microphone over maybe here.
Got the screen there, I'm so sorry.
I also do want to let Alyssa know I am on the phone. This is Phil Alt, the finance consultant for the medical care facility.
And am I understanding that one of the commissioners has a question?
All right, Commissioner Jelazinski also has a question for you.
Okay.
Hello, can you hear me now?
I think so.
I was reading your initial sheet and it said this is your last year for your millage. Was that original millage for improvements and some operation and medical care?
Yeah, that's one we got about 20 years ago.
All right, and that was made to pay off the improvements being made to the facility?
Are you talking about our bond payments?
The millage, yes, the bond.
Yeah, that was to pay off a bond.
Okay. You indicated it's cash flow bonds, and I saw that you said your census numbers were reduced. That means that fewer people in the medical care facility. Is that correct?
We do have lower census numbers currently, yes. We're down about 15% from prior to COVID.
But I kind of read into your letters that you're looking at some challenges coming forward. And I know 2020, a lot of agencies are in terms of revenue loss and operations increased costs.
Yeah, we are still experiencing that and expect to, especially with this new strain of COVID. And we're just now starting to see some staff. We've gone several weeks, even a couple months without any positive, and we're just starting to see that back now.
Do you anticipate any federal or state funds might help mitigate some of the challenges, fiscal challenges you're looking at, or anything known?
Can you answer that, Phil? Did you hear his question?
I did hear that question. I'm trying to remember. I think it was Senate Bill 23. Don't quote me on the number that just recently got passed. Actually, Senate Bill 27 on July 27th got passed, which is going to provide $23 a day of additional funding for Medicaid populations because of the fact that we've had a drop of greater than 5% in our occupancy for comparing 2021 to 2019. So that will supplement some of the cost of having the lower occupancy. And probably the biggest challenge is, even though we have a lower occupancy, costs have still remained fairly high from the standpoint that it takes a bit more to care for patients when you have to do all the COVID protocols that skilled nursing has to do.
I guess one final question is, since this is the end of the current 10-year millage, are you anticipating coming before the county board for some kind of a renewal or new millage for operation?
We've currently been discussing that, and a possibility, probably a significantly smaller millage amount though. So yes, that is something that we've been considering.
That's it, my questions. I do thank you. I know a couple of people that have gone through the medical care facility, and the families really appreciate the service you provide to the residents. Thank you.
Thank you.
Any other commissioners have questions? Commissioner Schwein?
Is your facility continue to lock down the residents during this new risk of COVID, or are you open up to family?
Currently 2-day. Luckily, some of the regulations lightened up in the spring, where even if we have a positive staff member, for instance, we only need to close visitation while we assess. We have to test everyone, all the residents and staff, and if we find no more positive cases, then we can immediately reopen back for visitation. So we've been open during certain hours for open visitation for a few months now. For vaccinated residents and staff, we also are doing in-person visits in a designated area for unvaccinated. Just to be transparent, for instance, today we did find out about a staff member. We'll do a full house testing tomorrow, provided that there's no positives, we can reopen back up on Thursday. So luckily, when we do have to shut down, and we can just keep certain units open. So maybe if our additional positives continue to be people who've only worked one unit, or, God forbid, a resident only on one unit, if we have it contained to an area, we can then open other areas of the building. So regulations changed between March and May, both the state and federal, to allow for less restrictive measures when you did have to shut down. But today I did have to close because of a positive staff. So we'll assess the risks of that and whether we have an outbreak or just an isolated incident, and then reopen accordingly.
Thank you. Alyssa, I have two more things. Imagine what the last 18 or 19 months have been in the light of the staff members.
Jim's probably the one I'm having the hardest hearing. I'm sorry to interrupt you, Commissioner.
Well, that, so anyway, just, I know the last 18 months has been very hard on you and your staff and everything. So, and again, I what you said to Commissioner Swain, is you're in a very regulated facility, and you have to follow everything. It's got to be hard on you and your staff and the residents there, because family members lost a lot of time with the people they wanted to see them. That's no fault of yours. I think you've done a wonderful job there. To the audience. Thank you.
Thank you. It's an honor for us to serve the elderly in our community. And, we've just done the best that we can to protect everyone and still, meet everybody's needs.
Thank you very much. Okay, we move on now to consider approving the 2022 budget village. The Isabel County Parks and Recreation Commission at 0.35. We run up to the podium. I'm in this building and then that goes down. Sorry, it's up by Isabel County Parks and Recreation.
Nice to see you all. Yes, we are looking to have our asked for our renewal of our 0.35 millage for the Parks and Recreation Commission. We've had our millage since 2012, and then for 6 years, and then the voters approved it again in 2018. And we're in our third year this year, the 6-year millage for Parks and Recreation. As you know, we've really needed this millage. We were experiencing quite a few cuts over the years. We've had numerous cuts for Parks and Recreation Commission. We usually get about $200,000 to $300,000 from the general fund to support the Parks and Recreation, and then the rest were from our revenues and through use at the park, and then also grants that we have gotten. As it states in my staff report, this has been very much an important lifeline for the parks. We have been able to do a number of projects. We have been able to afford increases that were approved through the wage study and also through minimum wage over the years for our staff. Projects that we never have enough time to do all the projects that we have, and there's still quite a long list. So the village has been very good to getting what projects we can get done during the year, and I just can't imagine not having it at this time. So We, in this report, my state, the, funds go towards our equipment, maintaining of the parks, hiring their staff, maintaining their staff, and offering quality facilities for people who utilize the parks. It also provides us matching funds for grants that we have received over the years, and we just hope that we can continue to go. You can see the amount of money through fiscal year 13 up to what has been budgeted request for 2022 and the estimate that we think we're going to get through the village. And I ask that we try to, if we can maintain that. During the pandemic, we get kind of the fun side of things where people come and use the parks. They found that utilizing the parks has been great for their physical and mental health for sure. We've seen an increase in our usage. We have reordered our daily annual stickers, annual stickers twice now. So we are definitely seeing the biggest increase in use of the park that we've ever seen in this time. So we just had a big agenda, so just let you know we're still here.
Questions? Commissioner Rayo.
Yeah, I was wondering, there's just recently been some money that's been passed in the legislature for parks, and the governor talked about that. Do you foresee maybe some of that?
Well, we hope so. I know our people that the state folks that work on the, we've never seen such an amount of money. I think it's over $200 million that we never put towards parks. But I do know the majority of it is going to, my understanding is to the state parks, but we'll see what happens. I know that there's been talk about it. Haven't really, it's only trickled down that from our state association executive director, announcing how pleased we are to hear that that's that passed. It's definitely a historical amount of funds to go into our state park.
Commissioner Johnson.
I just want to thank Sue Ann and Parks and Recreation Commission. I know they provide technical support to local units of government too. And Fremont Township was able to piggyback on the last update of the 5-year plan. And next June, they're going to have $112,000 playground next to Wayne Community Center without cost of those residents because of grants that were able to come about because of the recreation plan. And just recently, Cove Township needed somebody to do an inspection on one of their parks. Used to be a county park, it's a roadside park on Redwood Road near Shepherd. That's something that Sue Ann and the staff are able to handle for that township. So there is outreach to the townships too.
The other commissioners. Commissioner Slater.
I'd say that I'm disappointed you haven't invited us all out here to get to see all the improvements that boat launches and things.
That hasn't
finished yet, but
we're going out to bid here. Hopefully.
and how about the soil erosion area? Is that still on bid?
But yeah, we are waiting for the specs to our meeting together. So
I'd love to go for another walk.
we will invite you out there, sure.
The other commissioners. CN, I just what all the other commissioners said about your parks. I've had the opportunity to use the parks for walking. As I said, they have 5K. It's near death experience. And also to kayaking. It's just a wonderful thing. We went to great boat here. Not having the parks, not having the big park system. I don't know what this is going to do, but we're going with county parks, the city parks, and the other township areas. It's just, this boat county is a great place to live. It's just another. Thank you very much, Harvey. Thank you. Okay, next up, consider approving fiscal year 2022 budget and millage. Is County Transportation Commission at 0.862 of 1. And the director of the ICTC in front of us.
Good afternoon. Before I go on my brief presentation, I just want to say a brief thank you to this commission taxpayers for supporting all the services that we have in the county. I always love coming here, you know, it's a once a year thing, but it's so warming to hear all the services that this community offers and supports, and it can't be done without the collective efforts of everybody. Personally, as a citizen, appreciate that. Thank you to the staff and employees and volunteers that we've been all. So, we are back to request a continuation of our levy of our millage at 0.862. We've been levying this amount for since about 2002, I believe. So it's been a while we've done it at millage levy. Like everybody else, we are kind of in a budgetary roller coaster with COVID and everything that's been going on. Ridership has been at a decline with the stay-at-home, stay-safe orders, engineering control that we have to put on buses. To try to keep people safe, we have complexity on a lot of the buses that's been moved now. But that causes to remove fare boxes so we can keep our employees safe and keep our passengers safe, spread out people on the buses, et cetera, et cetera, et cetera. We just recently announced that we've expanded our services from running to Gratiot County, the city of Alma. That is a pretty big, substantial event for us. It's been something that's been in the works for decades. So that provides our residents the ability to get the services in Gratiot County, and likewise Gratiot residents who come into our county to seek the services that we have for the fellow county. That's win-win on both sides. That's a shared partnership between the Fellow County Transportation Commission and the Alma Transportation Center. We share the ride, or share the runs. Essentially, we do 3 a day, they do 3 a day. So that works out well. Last time I sat before you all, I was complaining about not being able to get employees. Boy, oh boy, has that problem got a whole lot worse today. That's probably our biggest challenge going forward, is trying to keep services on the road. We need to figure out a way to do better, maintain employees better than this. Long story short, receives.
So commissioners have questions for Mr. Carroll. Commissioner Ware.
Say the infrastructure bill passes, which the Senate's working on right now. Speaking of the majority here said that they're going to work until they got everything passed and all that. Do you foresee any money for transportation in this bill?
Transportation is a very vague term. Yes, there'll be money for transportation. What that means for public transit and bus transportation, you'll hold a ball game. Those talks are a little early yet. The House bill is a little more favorable to public transit than the Senate bill currently is. So let's put that on a wait to see basis. But you know, I think that we need to be careful looking towards the future, that we don't expect too much support.
Because then they said that several of senators said that they expected the vote to be this Thursday or by Thursday for the first one.
Yes.
And it did, there was sections for public transit.
Right. From what I read just before coming to this meeting, the National Organization, Community Transportation Association of America, is not at this time fully supporting the Senate bill. I haven't read it yet, but there must be something in there.
Any other commissioners? Commissioner Sparrow.
So, I saw in the 2022 budget that salaries seems to be less than previous years.
Yes.
Is it more efficient or for not being able to get enough employees? Is that why it's?
Yes, and yes. So we lost 21 drivers over the pandemic period. 21 vehicle operators were no longer employed. During the same period of time, we have 2 people currently in training across the trainers that we've been. So there is a definite lessened number of staff at our facility. Also, at the current budget cycle, we were anticipating losing some pretty big contracts that were 8 miles and hours off the road. I'm happy to report at this moment, we have regained a lot of those, so we're not going to use that. So we'll do a small budget revision with the state, but yes, we do expect less man hours, less minors, less hours.
Does the county need to address salaries of drivers so we can hire more, or is it other issues?
We have an independent board that does that.
Yeah.
We are getting ready to open labor negotiations in the next couple of months. That will certainly be a major talking point. I hate to say too much, but
Thank you.
Thank you, Mr. Collins, and your staff. I can't imagine, yeah, I keep saying this, I will very 18, last 18, 19 months, it's changed everything's world. It's really changed yours, how you address everything. So, good luck.
thank you.
Okay. Presentations and special reports, we'll look at the appointments, boards and commissions, which brings us to community reports. First up is finance and administration.
Thank you, Mr. Chair. Item number 1 is consider ratifying and placing on file the July 16, 2021 invoice list in the amount of $202,580.71. The July 23rd, 2021 invoice list in the amount of $179,532.13. And the adjustment list dated July 29th, 2021. So taking these one at a time, the July 16th list, the larger items that appear on the first page there are the items over $5,000. We have our hats, bi-weekly contract payment for the animal control, Preston Community Services, which does our equalization. And then Granger monthly compactor services for the material recovery facility. Carpal Solutions, down payment on software licenses for the prosecuting attorney's office. Chippewa River District Library, $36,000, $62.02 in quarterly penal fines distribution. And then Irwin and Lois Trains Trust, that was a treasury rebate for a PRE refund from the treasurer's office, the amount of $19,951.38. And then a couple of parcel accounts from the treasurer's office, Chippewa Township Treasurer, $5,240, and the Union Township, $7,762.50. COVID expenses listed separately at the bottom of this list were $3,944. Moving on to the July 23rd list, we had $26,151 for BSNA software, annual software maintenance. We had 3 consumers energy payments. Those would be for the admin building, at the sheriff's office, and the court building. And then Johnson Controls, $28,940. The new compressor for the chiller, the administration building. Those chillers working this time of year. And then the McBride Quality Care monthly day treatment contract payment of $38,885.74. So that's a monthly payment that we make to McBride for child care treatment. Works. And then the adjustment list dated July 29th. We have the Gordon Food Service early payment discounts that we always normally see. One invoice was voided because it had already been paid. It's the Oregon Pest control. And then another invoice voided because we had to pay by credit card. That's for changing $834.88. Must have been a conference or something. Yes, and that covers those. Any questions on any of those? Okay, hearing and seeing none, that item will move forward to tonight.
Second item is consider accepting and placing on file the fiscal year 2021 third quarter financial management services report as presented. Steve's here to run through his report.
Here that way. Don't everybody alone. Right next to them. Great, thank you. This quarter was a little bit back to normal, as it kind of talks about in the opening paragraph there. And we were on site almost every day, I think, that I was scheduled to be here. So that was very nice. Some sort of normalcy there to that. I'll just kind of briefly run through these quickly, the points in the report. First one, basically just being a resource to the county, answering questions as things came up. Was kind of one of the main focuses to try to keep things moving forward and resolve questions immediately rather than hang out there and resolve later. So that was one of the main things we've always tried to do as we've gone forward. The second point relates to the American Rescue Plan. That was another big focus for this year, with the county getting half of their dollars, half the 13.55 million. So that first half came in during the quarter, and so did a lot of work there, analysis, review, mainly the lost revenue calculation that came in front of the commissioners a few meetings ago, and doing that calculation and making that determination of analyzing 5 years worth of data and kind of coming up with that lost revenue calculation amount based on the calculator. The third point there, budget process, helped a little bit. Obviously, the Administrator Controller's Office has a lot of very talented people to do all of the work related to budgets. I was involved with a little bit of questions here and there and so forth as needed. And so I was able to provide as much guidance as needed during that process. Going over to the other 4 or 5 items there on the second page. Continue to work with trial court. They provide the reconciliations to us and we kind of do a little summary for the audit process. And so they provide that to us timely, and we have that ready for the auditors when they come winter. Point 5 gets into the chart of accounts. The state of Michigan has had several years that they've been working on chart of accounts revisions. Now it's finally come to fruition. So in your, as it says there, in your 22-23 budget, you'll see some revisions to the chart of accounts. Some funds will move, some account numbers will change, and so forth. Again, driven off of the state of Michigan's chart of accounts, and that affects everybody, not just the county, not just counties, cities, townships, villages. Affects everybody in the state of Michigan, basically. So, so that's a pretty big change. We worked through a lot of the information, provided it to ESNA for updating. They'll do the mechanical part of it, but we need to evaluate it before that to make sure that we're in compliance with the coming down. Number 6, getting into the what I have kind of coined the turbine funding spreadsheet. So looking at the turbine revenues, wind turbine revenues, and that projection that you all have seen before, and then looking at that, comparing it to the MERS and the jail debt distributions or payments into the future, and kind of performing that analysis. So that was some revisions were done to that during this quarter. And I think that will, come to the commissioners shortly, and then to be reevaluated as we've done some modifications there. Also, at that point, it talks about the bond anticipation note. So we also gathered information and attended various meetings and so forth related to that bond anticipation note and the issuance of that. And those funds came in early July. So, so that was done during the quarter ended also. And also attended various meetings, leadership meetings, finance committee meetings, work sessions, and so forth. Continue to review journal entries, going through that process, and kind of being the second or third set of eyes on the journal entries, and then also assisted with the quarterly financial quarterly reports that we're on the agenda next. That's kind of briefly, quickly playing through everything there. If there's any questions.
Is there any questions for Mr. President?
And we'll move this forward to the work session.
Okay, item number 3 is consider accepting and placing on file the fiscal year 2021 third quarter financial report as presented. And I think Margaret, you know.
Yes.
Thank you.
I was hand signaling with the deputy clerk. I thought she was cold. There's not much I can do about it. She said she's not. Trying to regulate the temperature for everybody. It's a challenge. So thank you very much. I'd like to start with the revenues. And again, I don't think that we need to go line by line. We can certainly do that if you prefer. We went through them pretty clearly at the finance committee. But you will know that this report is 9 months, so 75% of the year has gone by. You know, all of our finances and revenues and expenditures don't necessarily track 1/12 every month. But a couple of things I want to point out. Taxes, of course, always are, you know, it's always kind of scary to look at that percent because our taxes are just starting to roll in July. That will get made up as we move forward here. Our licensing permits, you'll see we're at 50%. We will be talking, not this meeting, but down the road about where we are with licensing permits, where we are with fines and forfeitures, where we are at costs, you know, charges for services. You know, we had not, last year did not receive in all of the revenue we expected because fees were down, fines were down, courts were down, other charges for services that we do were down. We're still down some. If you look at this, these percentages, you see that that's resulting in. If you go down to the transferring from direct costs here, you'll see that we were at 97%. We were at $18,000 differential. Just to answer, and that was a question that came up at finance committee, so I thought I would answer it to you for everybody. The question was asked, do we take the indirect cost rate allocation in terms of those departments that we receive indirect costs on quarterly or annually? We currently take those quarterly. We're talking on this 19 about starting to do that annually. We'll talk about that as we move forward. The $18,000 difference really is a time issue. This report ran as of June 30th. Since that time has happened, it's all evened out. So that's what that is responsible for. So we're not shorting ourselves 18,000. It's a good question. If you turn the page into expenditures, again, you know, you look at, okay, we're at 75% of the year. You see the board of commissioners are pretty much on track at pretty much 75%. Judicial was pretty close to their expenditures. General government, again, 73%. Public safety, 74%. Community and economic development, 63%. Public works, 95%. And then we look at you look at health and welfare, 66% of expenditures. With a contingency, we haven't used the contingency, so we're at 0%. And you look at other financing uses, we're at 79. So you can see that our expenditures are pretty much what they should be at this time of year. The revenues are lagging behind. We're hoping those will catch up some as we start to collect those property taxes, as the treasurer's office starts to collect those property taxes. But I do think that we're going to have some other revenue issues that, again, we can talk about down the road. If you look at our other funds where we are with revenues, you'll see that we received 96.93% of our parks and recreation, 61% revenue court, 88% commission on aging, about 61% child care, 58% central dispatch, 87% or so of inspections, and about 74% for recycling. As far as expenditures, it's interesting. It's interesting when you look at, Parks and Recreation again. They are down. This is the time of year Parks and Recreation really gets curfew. And you have all of those people camping and all those people coming into our parks, all of those good things. Front of the court is pretty much what we would expect that to be. Commission on Aging. Again, expenditures are lagging behind a little bit. That's okay. Again, we have some services that people are participating in yet at this point. Child care fund. I think again, because the courts are really starting to ramp up now, that we may see some more of those expenditures going up. Central dispatch, pretty much exactly steady where we should be. Inspections, pretty steady, and recycling. So when you look at that, and you look at listening to the presentations by those of our friends in the audience who were talking about the villages and talking about what a rough 18 months has been. It's been a rough 18 months for everybody, right? I mean, I look around the table here and I know a lot of stories from individuals, a lot of our employees' stories. A lot of people have lost people in their family, a lot of people have been sick, a lot of people have been challenged. And yet, I think that when you look at what everybody's been through for 18 months, we're not too far off target. And I think by the end of the year, it will balance itself out some. I don't know that we'll totally get into the level of revenues that we had anticipated. If we can make that up in the next couple months, I'm not sure that can happen, but we'll come back and talk about revenues and lost revenues and things that we have made. But this is where we stand now. I want to say that this report, you will see those of you who are used to the budget documents will notice that purposely the report follows the same structure. And that's what we have put in place here with the new, I don't want to say new, it's been 8 years now. We're not going to hear 8 years, it's been 8 years now. With the new budget process, the reporting process, all of that is the same procedures, the same way it looks. So it's putting all of this as we provide. And I'd be happy to try to answer any questions that anyone has, Mr. Chair. Okay. Thank you very much.
Thank you. That item will move forward to tonight's agenda, and that concludes the work of the administration.
Next up, criminal justice and county affairs.
Mr. Chair, we have 2 items today. Consider approving fiscal year 2022 county child care budget summary, DHS 2091. Michigan Department of Health and Human Services, NDHHS, county child care proposed application for children under the jurisdiction of Isabella County Circuit Court Family Division to ensure child safety, well-being, permanency, and rehabilitation of our most vulnerable population, and authorize the board chair to sign the same. And we have Court Administrator Carrie Curtis here to give us a summary and answer questions online. Very good. All yours.
Right. Good evening. So this is a pretty typical application. There are not a lot of changes. I will talk briefly about a couple of them. The first one is our basic grant funding. So the state allocates counties $15,000 of 100% reimbursement, and there are certain programs that you can use that for. So for fiscal year 22, we are intending to use that for counseling, drug testing, and psychological assessments. We did drug testing as part of this program for several years and then kind of cut back on it, but we are doing much more out of office drug testing due to COVID. So we've added that back in. The other slight change is that we have built in some possible funding for some operational increases that we anticipate may occur for day treatment and non-secure. Those are the facilities that the county owns the buildings, but we contract with McBride Services for their operations. And they are bringing back to us some proposals that I will be bringing to you all about some changes there. So we've been talking to Margaret about that. So I expect we'll be able to put something together soon. So we just wanted to prepare for that in advance and not have to ask the Child Care Fund for more money. So we added a little bit of money in for those services, should they change. Otherwise, it's the exact same presentation you saw last year.
Are there any questions for Curtis or Minister? All right, see, thank you, Carrie, for the summary.
Thank you.
Next item up, we'll move that one on to the regular session. For approval. Next item up, consider approving the amendment to the grant agreement between the Michigan Department of State Police, State 911 Office, Isabella County Central Dispatch for the 2020 9/11 call premise equipment sub-grant and authorize the board chair to sign the same. And Mark is here to explain the small change we have.
Good afternoon. Can you hear me?
You need to speak up, Mark, please.
Okay. How does this sound? Outstanding. Thank you, commissioners. This is an opportunity for us to yet save more money. The state is offering to reduce our grant match from 5% down to 3%. The savings is projected at $3,673.26. This is called the CPE, or Call Premise Equipment Grant, that we have used to upgrade all of our equipment for next generation 911. Project is almost complete. We're waiting for final cut over of Frontier next 30 to 60 days. And this would be an opportunity for us to save even more money by adopting the grant amendment.
Any questions for Mark?
Mark, kind of going off topic here, but what's your take and what's your feel on today's ongoing to the county?
Cautiously optimistic.
All the board members, everything you said, all my fingers crossed and toes crossed. Smooth course. We'll have good news later on this evening. So.
Excellent.
Definitely everyone should get out and vote.
Yes, please do.
Say get out to vote. Those who are listening, it's 5:15. Get out to vote. We don't say how to vote, but get out to vote. So.
All right. All right. Since there are no other questions, we'll move this on to the regular session. Thank you. And that finishes the business of criminal justice and county affairs.
Very good, Commissioner. So, part of your welcome. Thank you very much. Next up, Committee of Human Resources and Public Works.
Thank you, Mr. Chair. We have one item tonight. It's consider approving the August 2021 Michigan Council of Arts Cultural Affairs grant application request to support the Isabella County Parks and Recreation Commission event, Art from the Park 2022. We have our director explaining this longstanding and popular program.
Yes, and it's a free program. To the committee, right? I failed to put that in my report that people who come to the event are they get free entry into the park. So this we have received this grant for 7 years. We've actually had the program for 14 years, and Michigan Council for the Arts and Cultural Affairs has been a great support for us to be able to pay our artists, some of the artists that come to this event, and other folks that are at our MC is also paid just to have it be that much more supportive of the arts events. So we're really pleased that we have another opportunity to apply for funding. All this is just giving, having the board be aware that we are wanting to apply again for this grant. Didn't mean we got it. And this year we are asking for $4,000. We have increased the amount that we could ask for. We decided to go for the whole amount just so we can pay more artists. Something on that. So we need somebody that can see very well.
Okay, is there any questions or comments on this item?
Thank you, Commissioner. Suann, I didn't see a date for this event anywhere. You have that?
Yes, we have planned estimate to be the last Saturday in September.
Okay.
So,
Sounds
sorry
like,
about
sounds like it'd be a nice way to entertain my grandkids.
that.
Suann, about how many artists do you have there?
Well, it ranges. Last year with Outreach coming and helping us out, we probably had about 15 to 20 artists. We were able to pay about a dozen of them. Some of them are, we provide some funding to, in the past, the dance troops who we have kids come and dance. And sometimes we are able to pay them as well, just to the dance studio. You know, they be coming from one dance studio that come to the program for 14 years. You know, so we try our best to kind of spread the money. We have not all go to just, we have to have somebody that's in. We've had belly dancers there, we've had storytellers, we've had a storyteller or two that we pay for, jugglers, things like that. So we kind of mix it up with best that we can too. So kind of ranges between, I would say 10 to a dozen people. It really is a fun event.
Sounds like an interesting.
Pardon?
Sounds like an interesting.
It is. And if you read in my report, the way that it started was we were going to have a wild game soup. They, some CMU students started a wild game company, canned foods under the entrepreneur program. So I thought that would be kind of an interesting program. And then one day, Rick Stevens, who's part of Outreach, he was a volunteer there. He and his wife called and complained about a bicyclist almost knocking over his dog. And but he failed to tell me the dog was off on the beach. So but when I talked to him, I enjoyed so much talking with him. But when he told me that we used to always joke that the dog doesn't need to be on the beach, disturbing the mountain bicycles. But talking with him, he said, we just love Deerfield Park and I love to paint there and I love to, so we kind of combine the two programs. Now the wild game folks, and not that they went out of business, but they kind of went in a different direction, but then we've always kept our Outreach and our Summer Park as a art and Deerfield Park. So that little dog kind of brought a program together.
Any other questions or comments? Hearing none, this will be moved to our regular meeting. Thank you.
Okay, it's the work of the Human Resource and Public Works Committee. Next up, we have governmental affairs. We have no action. Nothing under administrative control reports. We have no unfinished business, which brings us to new business. I don't know.
Yes, if you remember correctly at the last meeting, so we had a closed session regarding a collective bargaining agreement. This is on the agenda tonight because it requires board action, so we initiate it. So the action that we're requesting is on your agenda. So someone needs to glance.
Vice Chairman, we not want to.
Or we don't do a motion.
No.
So apologize. I just spoke.
No, we have things to do tonight.
Yes.
So we don't have any motion tonight.
Not at all.
I got ahead of my game, sorry.
Okay. Next up, consider adopting the Minnesota County Board of Commissioners Resolution number 21-08-01, supporting American Rescue Plan state match programs, and authorize the board chair to sign the same. Margaret, is this something you want to talk to?
I believe that one of the commissioners asked to have this, was that you, Commissioner Johnson? Brought it up.
The MAC, Michigan Association of Counties, is trying to work with the state legislature to come up with some the state COVID-19 AP or whatever it is.
American Rescue Plan.
American Rescue Plan dollars. I guess the state's getting over $6 billion, and so they're trying to say, let's use some of those for some of the bigger projects, and we might be able to match those state dollars with local dollars, which maybe county dollars, maybe township dollars, city dollars. But this is just a resolution that goes back to MAC, that they can share with the state legislatures, the representatives, senators, to hopefully pass some legislation where we might be able to get more dollars in the mix, maybe to do a grand project, whether it's broadband or some other project, just to amplify the dollars that are available that we might have to benefit our residents here in the county. It seems like we should work with MAC to push that along.
Any other commissioners have any comments on this? Okay. Hearing and seeing none, we'll move forward to this meeting. Okay, next up, that concludes the new business. We move down to general public comments. I'll turn the audience first in the live version. Anybody have any general public comments? We'll give it 3 minutes. Also, state your name and address. No one making an rush podium, so we'll go to virtual, not the phone.
There is no one at this time, Mr.
No
Chairman.
one knocking on any phone lines, okay? Then I will close general public comment and turn to announcements. Commissioners, any announcements? Okay, hearing and seeing no announcements again. Anybody who's listening out there, it's 5:23 and full scale to 7 o'clock, so please go out and vote. All the commissioners in the audience had a chance to vote today. And support one actually in regards to the 911 surcharge. So with that ending, it's 5:24, and at the call of the chair, I will adjourn this business meeting. I say work session. Well, okay. You know, some call it one calls it business meeting, the rest of you calls it right.
So before the commissioners leave.
The last time I tried to.
I just want to.